Hepatitis C is a viral infection that causes liver inflammation as well as liver damage. There are several modes of transmission, including by blood and blood products, as well as contaminated blood through equipment or IV drug abuse. Hepatitis C can also be transmitted via infected sexual partners. The average incubation period for hepatitis C is variable, but usually ranges between 15 and 160 days. The clinical course of hepatitis C is similar to hepatitis B, and the symptoms are usually mild. People with hepatitis C are at increased risk for developing liver cirrhosis or cancer. This picture illustrates the progression of chronic hepatitis C infection. After about 20 to 25 years, it can lead to liver cirrhosis, and after 25 to 30 years, it can lead to end-stage liver disease and death. There are approximately 35,000 new cases of hepatitis C reported in the United States each year, and about 4 million people affected, making it the most common chronic bloodborne infection nationally. Hepatitis C is the most common reason for liver transplantation and is a cause for about 10 to 20,000 deaths in the United States per year. There are several risk factors for hepatitis C, including those who have received blood products or organ transplant before 1987, healthcare and public safety workers after needle stick injuries or exposure to blood, children born to women with hepatitis C, past or current illicit drug users, as well as those who practice unprotected sex with multiple sex partners. Treatment of hepatitis C includes a combination of antiviral drugs, such as peginterferon and ribavirin, which are effective at treating hepatitis C relapses, and some patients can even experience complete remission from hepatitis C. The FDA has approved the proteases telaprevir and boceprevir for treatment of genotype 1 hepatitis C patients. The American Association for the Study of Liver Disease recommends standard treatment triple therapy, including one of the aforementioned proteases, peginterferon, and ribavirin. Prevention of hepatitis C includes the avoidance of high-risk behavior such as IV drug use, the use of needleless IV injection systems in healthcare, the use of barrier precautions, cleaning, disinfection, and sterilization, the avoidance of multi-dose vials in patient care settings, as well as the use of standard precautions in clinical care. Hepatitis E is a virus that is transmitted by the fecal-oral route, primarily through contaminated water in areas with poor sanitation. The average incubation period for hepatitis E is variable, but it is estimated that it ranges between 15 to 65 days. In general, hepatitis E resembles hepatitis A in that it has a self-limited course with an abrupt onset. Symptoms of hepatitis E include jaundice, anorexia, indigestion, nausea, and epigastric discomfort. The symptoms of hepatitis E are very severe in pregnant women. Although the effectiveness of immune globulin therapy in protecting against hepatitis E is uncertain, avoiding contact with the virus through good hygiene, including hand washing, is the major method of prevention for hepatitis E.
Convalescence due to hepatitis infection can be 3 to 4 months, including bed rest until liver enlargement and bilirubin levels resolve. Gastrointestinal symptoms may require administration of IV fluids if vomiting is persistent. Dietary recommendations include reduced protein intake, short periods between frequent small meals, and avoidance of alcohol due to poor metabolism. Aim for fruits, vegetables, lean meats, low-fat dairy, and complex carbohydrates to reduce stress on the liver by binding fiber to excess fats. Health history screening matters. As healthcare providers, we should assess risk and immunity for all patients, provide testing for family and partners with known exposures, and test those at risk for hepatitis for other blood-borne pathogens, such as HIV and syphilis. Our patients also need tools for harm reduction when they do engage in behaviors that put them at risk, which may include access to clean needle kits or syringe exchange programs and safer sex education. In context of the Newman systems model, hepatitis infection stresses the physiological domain via acute or chronic liver decompensation and failure. Psychological stress due to long convalescence can lead to caregiver role strain, financial stress, and concern about infecting others. Certain populations are more greatly impacted by hepatitis, including those born in the Asia Pacific region, IV drug users, and men who have sex with men. The very young and the very old are at a higher risk for serious hepatitis outcomes due to the immaturity or aging of liver function and immune response. Spirituality can be a resource for healthy emotional coping and community support. Religious and folk beliefs may also influence medical decision making.
A client has developed hepatitis A after eating contaminated oysters. The nurse assesses the client for which expected assessment finding: A. Malaise, B. Dark stools, C. Weight gain, or D. Left upper quadrant discomfort. The answer is A. Malaise. Remember, the signs and symptoms of hepatitis A are flu-like. A patient with hepatitis B is being discharged in 2 days. In the discharge teaching plan, the nurse should include instructions to avoid alcohol for the first 3 weeks, use a condom during sexual intercourse, have family members get an injection of immunoglobulin, or follow a low-protein, moderate carbohydrate, moderate fat diet. The answer is B. Use a condom during sexual intercourse. Hepatitis B is a sexually transmitted disease that is acquired through unprotected sex with an infected person. When teaching the male patient with acute hepatitis C, the patient demonstrates understanding when the patient makes which statement: I will use care when kissing my wife to prevent giving it to her. I will need to take Hepcera to prevent chronic HCV. Now that I have HCV, I will have immunity and not get it again. I will need to be checked for chronic HCV and other liver problems. The correct answer is D. I will need to be checked for chronic HCV and other liver problems. The majority of patients who acquire HCV usually develop a chronic infection, which may lead to cirrhosis or liver cancer. It is not transmitted via saliva but percutaneously and via high-risk sexual activity.